Welcome to the Veterinary Rehabilitation Podcast, where we aim to help fellow veterinary rehab therapists increase their knowledge and elevate their practice. I'm Megan Kelly.
And I'm Anae Lloyd. Together, we bring you the latest insights, research, and information in the field of veterinary rehabilitation.
This podcast is brought to you by Onlinepethealth, a leading continuing education membership for veterinary rehabilitation therapists. With Onlinepethealth, you will have access to a wide range of online resources to help you stay up to date with the latest techniques, advances, and trends in the industry.
Our podcast features in-depth conversations with leading experts in veterinary rehabilitation. They share their own experiences and knowledge to help you improve your practice. Whether you're a seasoned pro or just starting out in the field, our goal is to provide you with the tools and the insights you need to succeed.
So join us as we explore the exciting world of veterinary rehabilitation and help you take your practice to the next level. Hey vet rehabbers, in today's podcast we're diving into a somewhat controversial topic, immobilization or early mobilization after an acute soft tissue injury. Understanding when to mobilize and when to immobilize healing tissue is key to achieving the best outcome for soft tissue recovery. Now, Ansi Walt takes us through a review of the research on both approaches and shares insights on the optimal healing process for acute soft tissue injuries. Today, I'd like to say a huge thank you to Joe from Zen Canine Therapy. Thank you so much, Joe, for the shout out on Instagram stories about the Veterinary Rehabilitation Podcast. Please can you reach out to me on meg@onlinepethealth.com because I'd love to gift you a limited edition Veterinary Rehabilitation Podcast mug. Now, if you are someone who's looking for some free online learning, we've got you covered. Alongside our membership, which includes over 500 hours of vet rehab specific content for equine, small animals, and hydrotherapy, we also offer free webinars through our limited access free membership. Now, the latest updates include The Biomechanics of Agility by Ariel Pachette-Markley, Capitalizing on Canine Cognition During Hydrotherapy by Ansi Walt, and Returning the Equine Athlete to Work After Injury by Lee Clark. Before we head over to my chat with Ansi, a quick word from our sponsor. Nada first developed her courses at the Colorado State University, where she started the Medical Acupuncture for Veterinarian Certificate Program in 1998. In so doing, Dr. Robinson developed a science-based platform for veterinary acupuncture, the first of its kind. Today, Cure Vet offers a comprehensive curriculum in integrative medicine with a rational, evidence-supported foundation. Courses include medical acupuncture, photomedicine, botanical medicine, medical massage, and integrative rehabilitation. You can discover Cure Vet at curecore.org. All right, let's hear what Ansi has to say.
Hi, everybody, and welcome to this Online Pet Health Research Refresh. Today, we'll be looking at whether immobilization or early mobilization is best for recovery after an acute soft tissue injury. And this is a review that was done by Pekka Kanus, who is a medical doctor. But some really useful information in here, so I hope you enjoy it. So what was the background and objective of this study? So we know that acute soft tissue injuries such as muscle and tendon strains, ligament sprains, or ligament and tendon ruptures do occur frequently in sports and exercise, and particularly with our canine patients being so enthusiastic about living life to the fullest, they often injure these just playing with each other or running around the garden. So we need to know what the best strategy is to ensure optimal healing of these conditions. So just a little bit of background about the phases of healing after an acute soft tissue injury. So the first stage of healing is the inflammatory stage, which usually lasts for up to about a week. And this is a really important stage of recovery because this is where the body cleans out all of those damaged tissues, make sure that if there's any infection that's addressed, and it sets up the body for optimal healing. So the inflammatory phase is really important, but one must always remember that in this stage of healing, there is no structural integrity to that tissue. So that tissue cannot cope with any stress or pressure. Then the next stage, which lasts for about 3 months, is the proliferation phase. And the duration of how long this lasts obviously depends on the extent of the injury. So anything between a week and 3 weeks. So during the proliferation phase, the body is starting to rebuild the tissue so that it looks a little bit more like normal. So this is this second image on the left of the body starting to replace the damaged tissue with new tissue cells, and it's starting to restore the structure of the tissue a little bit more to normal. After those 3 weeks, you start to move into the maturation and remodeling phase, and that is where the body now is starting to restructure all of this healing tissue to look as much as the original uninjured tissue as possible. So the body starts to address fiber alignment to make sure that the scars are a nice, healthy, well-aligned scar. The blood vessel network gets restored to normal, and any excessive tissue gets pared down so that the structure can function as well as possible. So here's a little bit of a graph of what to expect with the different kinds of soft tissue injuries. So if it is a muscle injury, and it's just like a little bit of an exercise-induced muscle strain, healing time is around about 3 days. But when you start to get some actual damage to the muscle fibers, it starts to take a little bit longer to heal. So you have your grades of injury, obviously tendinitis as an inflammatory pathology of the tendon, and tendinosis is where the tendon has stopped healing properly. There's not really any inflammation, but the tendon isn't doing a great job of replacing the damaged tissue with healthy tissue. And that has an effect on duration of healing. So it's just really important to make sure you have a good idea about that, the degree of the injury that you're dealing with, and have an idea in your head of how long you can expect healing to take place, because that will really affect your clinical decision making. Okay, so just a little bit of a reminder, both muscles and tendons. A grade 1 strain is just a little bit of overstretching of the tissues and some small tears. A grade 2 is a slightly larger tear, and a grade 3 tear is a complete disruption of that tendon or muscle. All right, so much more significant injury. So in this article, they talk about starting all soft tissue injuries off with prices. Now, this was an article that was published in 2020. And since then, the protocols for acute management of soft tissue injury has been upgraded and expanded on a little bit. So this is the latest protocol for initial management of soft tissue injuries, and it's called Peace and Love. So in the first, the first couple of days, you want to make sure that you properly protect the damaged tissue against any excessive movement. You want to try and keep it elevated, which obviously is always a bit of a challenge with our animal patients. Always avoid anti-inflammatories in those early stages. You can give analgesics if necessary, but you actually don't want to disrupt the inflammatory process too much, because it does really valuable things to set the body up for healing. Try and see if you can add some compression for that tissue just to support it a little bit, and educate your client about rest, about protection, and about not panicking in the initial phases. It's going to take a little bit of time, but the body will heal. Once your acute inflammatory phase is over, you need to then start gently loading the tissue so it can stimulate proper healing, help your client to remain optimistic throughout the process, that an injury is something that the body is capable of healing. Soft tissue injuries, if managed correctly, can heal very well. You want to make sure that you promote a lot of circulation, and cardiovascular exercise also comes into that. So if you can do safe cardiovascular exercise without overloading the tissue, that's absolutely super, and the correct type of exercises. So I just popped this in here because this is the updated recommendations, as opposed to the prices, which is the one that was still discussed in this article. So what they did is, this was a review article. So they looked at some of the published literature about soft tissue injuries, and they looked at experimental studies as well as clinical trials. So what did they find? So in terms of muscles, there are a lot of studies done on rats and rat muscle healing. And they look a lot at the calf muscle of the rats, and they found that immobilizing the muscle immediately after injury limits the amount of connective tissue formed within the injury, which is important. Connective tissue is basically a scar. So by mobilizing it for a little bit immediately after the injury, you get less of a big scar forming, and the scar in terms of muscle tissue is not really what we want because it's not functional contractile tissue. Whereas if the rats were mobilized immediately after the injury, it resulted in a really, really dense scar, and then you didn't get nice, healthy muscle formation. So this is referring specifically to the period immediately after the injury. So those first couple of 3 to 5 days, maybe up to 7 days if it's a really, really bad injury. But right after that, you do need to start with mobilization. So this immobilization isn't for a couple of weeks like we used to do a long time ago for soft tissue injuries. It's literally just the first couple of days. Okay, the best results you get when you start mobilizing your patient 3 to 5 days after immobilization. Okay. In terms of tendons, again, rats have given us a lot of knowledge, so we have to always thank rats for their contribution to what we know about tissue healing. Early mobilization in the case of tendons, so again, early mobilization is not the day after the injury, it's a couple of days after, sort of 5 to 7 days after the injury, significantly improved the strength of the tendon once it was repaired compared to when that tendon was immobilized, so maybe put in a cast or completely restricted. Okay. So mobilization enhanced the orientation of the tendon tissue that was healing. So that really helps to build a nice, healthy, functional tendon that does the job it's supposed to do. So after that inflammatory phase, 7 days, controlled stretching and strengthening of the regenerating repaired tendon is likely to increase the final tensile strength properties of the tendon. Then I looked a little bit at the research around ligaments, and they spoke about animal models. They didn't say which animals, but when I went to take a look at the studies that they referenced, it seems that most of the work has been done on rabbits. So experimental tears of the medial collateral ligament of the stifle of animals healed much better with early controlled mobilization than with immobilization. So again, this is a kind of tissue that doesn't like to be immobilized for too long. I remember when I started with physio, the cruciate ligament repairs were put on a Robert Jones bandage for several weeks. Now we know we're not doing the dogs any favors by doing that at all. If we can get early controlled, and another word I would put in there is protected mobilization. So you maybe want to have them in a brace of some sort so that they can't overdo it, then you get much better results. In fact, it's so good that if you compare with a ligament injury in rabbits, early mobilization compared to surgery, the early mobilization animals that didn't have surgery did even better, provided that the joint wasn't completely unstable. So that is really interesting. So if you have a partially injured ligament, the joint is still stable, then early mobilization may get you equally good, if not better results than surgery, and obviously depending on the dog, the extent of the injury, and the location of the injury. All right. So then they looked a little bit at human studies, and they found that early controlled mobilization is superior to immobilization, not only for primary treatment, but also, so primary treatment means conservative treatment, so where there's no surgery, but also in post-operative management. So when you do early controlled mobilization, you get quicker recovery, quicker return to full activity, and this is true across the board for ankle ligament injuries, ankle instability, knee ligament injuries, cartilage injuries of the knees, even some fractures that aren't completely displaced, and also Achilles tendon ruptures. So some of the limitations of the study is that it didn't look at specifically at the animals that we more commonly treat. So there aren't studies included here that look specifically at these injuries in dogs or cats, mostly rats and rabbits. And they are good models for soft tissue injuries. There are some differences in how rats heal compared to mammals, which is worth bearing in mind, but it does give a good indication of how soft tissue tends to respond to specific treatments. And also this was shown to be valid in the human studies as well. Some of the studies included in this review was quite old as well, which is always something to just bear in mind. If you see that a lot of studies in a review are really old, it's worth just seeing if there's any newer information that contradicts that. Often newer information just reinforces what previous studies have said. So, implications for clinical practice. There's lots of benefits to early mobilization of soft tissue injuries, reduction in pain and swelling, less atrophy of the muscles surrounding that area. You help to prevent or reduce joint contractures. You get healthier cartilage, and you don't get that proprioceptive loss that you do when you have extended periods of immobilization. So you want to get controlled movement sooner, and the golden rule here is within limits of pain, and everything that isn't explicitly forbidden is allowed. So if it's explicitly forbidden for the dog to jump up onto a couch, absolutely can't jump up on the couch. But if it's not a big problem for the dog to walk around the office where mom is sitting and working from home, that is absolutely fine. And yes, this is more challenging in animal patients. We often say that return to movement should be controlled by or limited by pain. So do anything as long as it doesn't make your pain worse. But it's hard for the animals to understand that. And if they get excited, they hear the doorbell ringing, they won't limit their own activity. So there's a little bit of nuance to this. Yes, you're allowed to do as much as doesn't irritate the tissue and doesn't increase your pain. But with dogs, we need to help them control this a little bit more. And cats and horses. So, hope you're taking some interesting tips from this one and just remembering the benefits of early mobilization. And I think it's really important not to be afraid of early mobilization, because the benefits will always outweigh the risks, provided you ensure that your patient is safe, that the structure in question is safe and protected. Try and find a way of having early protected mobilization. And remember, peace and love.
If you enjoyed this podcast, please hit the subscribe button so you get notified every time I load a new podcast. I'm here every week talking to vet rehab therapists from all over the world about all things vet rehab. A big thanks to our sponsor, Curacao Vet. Their sponsorship allows us to be able to give this podcast to you for free, so please go and check them out at curacao.org. Please also don't forget to bookmark the next Vet Rehab Summit. It's on Saturday the 8th of November in 2025. Come and be a part of the world's largest online veterinary rehabilitation conference created specifically for you, the vet rehabber community. Onlinepethealth members, you get VIP complimentary access to the Vet Rehab Summit. For more information about continuing education for vet rehabbers, you can go to onlinepethealth.com.